video, we will discuss the kinds of changes that you can expect to see in your body and the measures that you can take to care for yourself in the weeks following your vaginal delivery. In the next few minutes, we will discuss diet and activity, bathing and wound care, breast care, medication use, warning signs, and when to see your provider.
Hi, I'm Josh. I'm your nurse. I'm here to talk to you about some discharge instructions.
Okay.
I'm going to start with diet and exercise. In the next few weeks, you're going to have to drink a lot of water and eat foods with a lot of fiber like fruits and vegetables.
Okay, and when can I get back to my pre-pregnancy weight?
Well, they say it's safe to lose about 1 to 1.5 pounds per week, but you should wait 3 weeks before you start dieting for any sort of weight loss.
Oh, and what about exercise?
For exercise, you can gradually increase your activity little by little. Start with walking. You shouldn't lift, push, or pull for 2 to 4 weeks.
Okay.
And just try to rest frequently, especially when the baby's resting.
Oh, okay.
You should feel less discomfort every day from any stitches you receive. Perennial stitches will dissolve in 5 to 7 days. Surgical stitches may need to be removed. You may shower with the stitches or clips on. Drip plain or soapy water over the incision and dry gently with a clean towel.
So I'm a little embarrassed to ask, but when can I resume sexual activity?
Well, we recommend nothing in the vagina for at least 6 weeks. That includes douching, tampons, and sex. But after that, you can resume normal sexual activity whenever it's comfortable. Water-based lubricants might help because there may be some vaginal dryness due to the change in hormone levels and stuff like that.
Oh, and they gave me a Peri bottle. What's this for?
You can use the Peri bottle to clean yourself after going to the bathroom. And also, I want to remind you to always wipe from front to back to help prevent infection. While we're talking about hygiene, I want to just remind you to change your pad on a regular basis because bleeding can occur for up to 6 weeks. And don't be alarmed if there's a color change because it naturally goes from red to pink to white and then it'll stop altogether.
Oh, I'm glad you told me that. I would have worried about the color change.
Your breasts and nipples may have changed in size or shape during your pregnancy. Wearing a well-fitting, supportive bra that lacks underwire may be more comfortable as your body adjusts to these changes. If your breasts are tender or uncomfortable, lay on your back and apply ice packs. Do not apply heat, and do not use soap on your nipples as this may remove the natural lubrication. If you have any questions about breastfeeding, which is recommended, you can talk to the lactation consultant at your hospital.
I just wanted to talk to you a little bit about your medications. We want you to keep taking your prenatal vitamin for at least 6 weeks. If you experience any pain, you can use Tylenol or ibuprofen, but before you start anything new, please consult your primary care provider. Hi Tabitha, I'm back.
Hi.
So you and Tommy have been cleared for discharge. I'd like to tell you about some warning signs while you're at home, which could mean it's time to call your provider. So we want you to look out for heavy bleeding, which is anything more than 1 pad soaked in an hour. Look out for big clots, which is anything bigger than the size of a golf ball. And report any foul odor from the vagina. Do you by any chance have a thermometer at home that you know how to use?
Yep, I do.
Okay, be on the lookout for a temperature over 100.4. That would mean it's time to call your doctor. If you experience painful, hot, swollen breasts, this could be a sign of a breast infection. It's normal to feel emotional or sad in the first few weeks postpartum, but call your doctor if your baby blues last over 2 weeks.
So, just to go over what you said, I should call my provider if I experience any signs of heavy bleeding, infection, or signs of depression.
That's correct.
Okay.
And assuming everything goes well, you should still have a follow-up checkup in 4 to 6 weeks so I can assist you to make an appointment with your doctor.
Thank you.
We hope you've enjoyed this video presentation about your postpartum self-care. If you find that you have any other questions or concerns about your self-care, please don't hesitate to ask your nursing staff. We're here to help. Thank you,
And good luck!
We hope you've enjoyed this video presentation about your postpartum self-care. If you find that you have any other questions or concerns about your self-care, please don't hesitate to ask your nursing staff. We're here to help. Thank you,
And good luck!